Hi, you guys. Welcome back for our daily practice questions. It is day 42, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 45-year-old female patient presents with a complaint of palpitations and dizziness. During your exam, you detect a systolic murmur that is audible with the stethoscope lightly placed on the chest, but it is of low intensity. The murmur does not radiate. Based on these findings, what is the most likely grade of this murmur? Is it A, a grade 1 of 6? Is it B, a grade 2 of 6? C, a grade 3 of 6? Or D, a grade 4 of 6? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question. Now, y'all know I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, based on these findings, what is the most likely grade of this murmur? And basically, this is like a diagnosis question, right? Because you're diagnosing the grade of the murmur, right? So you're going to do it in the same scenario. You need to run it back and look at those assessment findings. So what do we have going on? We have this 45-year-old female came in complaining of palpitations and dizziness. On your exam, you detect a systolic murmur that is audible with the stethoscope lightly placed on the chest, but it's low intensity, right? All right, so a few things that I would tell you to walk through. Immediately, you can eliminate D because it does not mention a palpable thrill, right? And grade 4 is when the palpable thrill starts, right? So we know it has to be 1, 2, or 3. Now, it says that it's audible with the stethoscope lightly placed on the chest, but it's low intensity. So the best answer is B, a grade 2 of 6, right? It's low intensity. You know, these are on the lower scale, but you can lightly place it on the chest to identify it. Question number two, a 68-year-old male presents with a history of CHF and is noted to have a systolic murmur during exam. You observe that the patient it, I'm making up words, aren't I? You observe that the murmur is loud, has a palpable thrill, and is heard even when the stethoscope is held slightly off the chest. There is also associated radiation to the neck. What grade murmur would be most consistent with this description? Let me run it back, y'all. A 68-year-old male presents with a history of congestive heart failure and is noted to have a systolic murmur during exam. You observe that the murmur is loud, has a palpable thrill, and is heard even when the stethoscope is held slightly off the chest. There is also associated radiation to the neck. What grade of murmur will be most consistent with this description? Is it A, grade 3 of 6, B, grade 4 of 6, C, grade 5 of 6, or D, grade 6 of 6? Tell me what you got in the comments, y'all. All right, so stem of the question here, what grade of murmur would be most consistent with this description? All right, so let's go and see what we have. This is a 68-year-old man, came in, he has a history of CHF, systolic murmur is noted on exam. The murmur is loud. There's a palpable thrill. So I'm going to pause right there. Palpable thrill, we know it has to be grade 4 or greater, right? Because the palpable thrill starts at grade 4. All right, so we can eliminate A, right? So B, C, or D are our potential answers. Again, so the murmur is loud, there's a palpable thrill, and it is heard even when the stethoscope is held slightly off of the chest. So your best answer is C, grade 5 of 6. Grade 4, the stethoscope still needs to be at least lightly on the chest to be heard, but the palpable thrill is first noted there. And that's the key for grade 4. Grade 5, You know it's going to still be the palpable thrill because that initiated in 4. But grade 5, you can still hear it with the stethoscope slightly off the chest. And then we'll get into grade 6. Let me finish with the questions so I'm not giving away answers. All right, and question number 3. A 60-year-old female with a history of mitral valve prolapse presents with intermittent chest discomfort. Upon auscultation, you hear a soft, low-pitched murmur that is only audible when the stethoscope is placed firmly on the chest and does not radiate. No thrill is detected. Which murmur grade does this presentation most likely indicate? Is it A, grade 1 of 6? Is it B, grade 2 of 6? Is it C, grade 3 of 6? Or is it D, grade 4 of 6? Take a moment and tell me what you got, y'all. All right, stem of the question. Which murmur grade does this presentation most likely indicate? All right, so let's run it back again. It's a 60-year-old female, history of MVP, intermittent chest discomfort, but while auscultating, you hear a soft, low-pitched murmur that is only audible when the stethoscope is placed firmly on the chest. There's no thrill, it does not radiate. So number 1, no thrill, we can eliminate D, right? Because that's 4, and that's when the thrill starts. So we know it has to be 1, 2, or 3. But the key here is it's soft, it's low pitched, and placing the stethoscope firmly on the chest is the only way that we really can identify this. Y'all, that's grade 1. So A is your best answer. You know, grade 1 is really, really faint. It's that soft, faint murmur that you have to place firmly and really lock in to identify on most cases to hear it and pick up on. There's no thrill associated. This is grade 1 of 6 all day, every day. Now, back to question number 2, where I was talking about the stethoscope being held slightly off the chest. Again, grade 5 or 6 has a palpable thrill also, but you can hear that murmur with the stethoscope slightly off the chest. But grade 6 of 6, you will have that palpable thrill, but you can also hear that murmur even without the stethoscope on the chest. So pay attention to those key factors when there's descriptions of murmur and you're asked to identify and grade them, okay? All right, you guys, I hope you're finding these helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursinstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions or custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.